tragic infant deaths in Chhindwara linked to contaminated cough syrup. Swift action is now currently underway. Following Chief Minister Dr. Mohan Yadav's directive, the license of Apna medical stores in Parasia have now been revoked. The Food and Drug Administration in Madhya Pradesh has issued strict order, and the state's drug department is on high alert, conducting widespread testing and preparing raids on pharmacies across multiple districts, including in Bhopal. At the national level, the Union Ministry of Health and Family Welfare recently held a high-level meeting. In fact, the review meeting chaired by Union Health Secretary Punya Srivastava also looked into the cold reef cough syrup matter. The meeting, in fact, focused on enforcing drug quality standards as well as rationalization of use of cough syrup in children following directives from Union Health Minister J.P. Nadda. Meanwhile, Chief Minister Mohan Yadav met with families and affected people of the tragedy. In fact, having cancelled his engagement in Bharwani and Jabalpur, the state government assured the public that vigilance campaign will continue until the investigation is fully completed in the matter. Moving on now, following the tragic death of children linked to cold reef again in Madhya Pradesh, several states, as I mentioned earlier, including Himachal Pradesh and Uttar Pradesh as well as Karnataka, have now banned the sale and prescription and the use of the cough syrups. Uttar Pradesh has ordered a thorough collection and testing of cold reef samples from across the state, while Karnataka's health minister has also assured the public that the syrup was never distributed there. This crackdown comes as the deadly syrup has already been banned in multiple states, including Rajasthan, Madhya Pradesh, Kerala, Tamil Nadu and Uttarakhand, as authorities race to prevent further tragedies. And the latest that we are getting as far as the deadly cough syrup is concerned, there's more action now. Cold reef has been banned in Karnataka, Tamil Nadu, Uttar Pradesh, Uttarakhand and Himachal Pradesh. In fact, as far as later states to join that action against cold reef is concerned, Himachal Pradesh has also now banned cold reef. Moving to Madhya Pradesh, where the Food and Drug Administration has issued strict orders and the state's drug department is on high alert, conducting widespread testing and preparing raids on pharmacies across multiple locations, including capital Bhopal. At the national level, in fact, Union Ministry of Health and Family Welfare recently held a high-level review meeting chaired by Union Health Secretary. The meeting focused on enforcing drug quality standards and promoting the rational use of cough syrup among children. All right, we're trying to get you the latest as far as the deadly cough syrup that has now claimed the lives of many children. We are given to understand many states now across India have banned the cough syrup that is responsible for killing more than 12 people, more than 12 children as a matter of fact. Various officials have now started conducting raids in many states. Drug controllers are now on high alert, issuing notifications to respective states and authorities, asking them to limit the use of cold reef. My colleague Nancy joining us with more details. Nancy, as far as we know now, many states have joined the chorus banning those, cough syrups that could be deadly, but more specifically cold reef, which is now responsible for taking many lives.
Absolutely, Shweta. Like what we are getting right now is that 9 states have banned the cough syrup that is in question, cold riff. This comes after the Indian Health Ministry has also said in a statement that all the samples that have been collected of the cold riff cough syrup, it has found the DEG, the dikene glycol, in all the cough syrups, and I think it's an important step that every state has joined the precautionary step because lives of children are at stakes here. 16 deaths from Madhya Pradesh that we are getting the latest number right now, and all the other states have joined the chorus of banning the cold syrup because cough syrup that you usually give to children is you don't assume that it will take your children's life, and this is what is happening right now. The sale of syrup has been banned throughout Madhya Pradesh. Mohan Yadav, the chief minister, has come out and has said that he has informed the Union Ministry of Health about the development. The probe is underway, investigations are underway. We are getting ground reports that the drug team is going to local medical stores and they are taking samples of the cough syrups that have been in circulation for the longest time. And people are going through it. The probe is underway. Union Ministry has issued an advisory and has asked to regulate the consumption and to regulate the sale of these cough syrups because the life of children are at stake as of now. And the probe is underway. India's pharmaceutical industry has always been under scrutiny because of this. There have been many incidents. One World Health Organization has also linked cough syrups made by some Indian company, which had led to the Gambia outbreak earlier as well. So it is very important right now to take precautions because everything is at high stake. Pictures are coming in of children who has lost their lives, and it is important to take that precautionary step until the probe is done because some kidney failure was one of the major cause that came out in the report. So the samples are being tested. The probe is underway, and it's the cough syrups that have been in circulation should not be there, and should be a regulation on the consumption of the syrup as well.
Regulation on consumption of the syrup. Doctors have also come under scrutiny. The Food and Drug Administration of various states have come under scrutiny for this is the least expected result of using a cold and cough syrup. Children are dying. They are dead. Questions being raised on the drug safety in India, specifically the contamination related to diethylene glycol. We've spoken to experts earlier and they suggested that this could be the possible reason why that cough syrup became deadly. Perhaps stringent action needs to be taken and also a call to finally wake up to stringent regulations in drug safety matters. Thank you very much, Nancy. Major action by Mohan Yadav government in the Chhindwara tragedy where 14 children lost their lives due to contaminated cough syrup. Chief Minister Mohan Yadav has removed IS officer Dinesh Maurya from the post of drug controller in the wake of that incident. Taking swift and strict action, the Chief Minister has also suspended 3 officials. Shobhit Kosta, Deputy Drug Controller, Licensing Authority, Drug Administration Bhopal, Sharad Jain, Drug Inspector Jabalpur and Gaurav Sharma, Drug Inspector Chhindwara. And the Madhya Pradesh government, they're acting swiftly and suspending 3 officials in the wake of that cough syrup scare. The move comes amid mounting outrage and demands for accountability over the tragedy. Joining me on the show is Dr. Dilip Bhanushali, National President, IMA. Thank you very much, Doctor, for taking time out. Let's begin with where does the responsibility lie? We are looking at various chief ministers now taking action, various states taking action, removing their drug controller, tightening their norms. But norms are already in place. The fact of the matter is this was a contaminated cough syrup that many children drank. So where does the responsibility lie?
At the onset, let me convey our sympathies and condolences to the bereaved families. Lost almost 14 to 16 children, both in Rajasthan and in Madhya Pradesh. Your question is pertinent in sense the government is taking action after this incident has happened. What was they doing it before it? Why was this medicine was put into the market without checking the ingredients of this? What were the drug controllers doing? And without doing this, you arrest a doctor without finding the total facts of it.
Yeah, 100%. So, as far as contamination is concerned, run us through what really happened there, because various reports coming in, doctor, at this point in time, that this could be a diethylene glycol, contamination, and that resulted in the cough syrup becoming deadly. In your understanding, was it just
That's
this component?
diethyl glycol in certain percentage is a very dangerous, and it can affect your kidneys. Kidney failures can occur. So, so this is contraindicated in cough syrup. Unfortunately, this was found in this cough syrup which they had used.
Okay, so can we say at this point this was pharmaceutical negligence? And if this was pharmaceutical negligence, that FDA is responsible in all these states, or FDA is responsible, in fact, at the national level also?
So this is, see, the ingredient was sent, the sample was sent to, I think, in Tamil Nadu, where they found that contamination has occurred. And then it was should have been monitored by the drug controller. Why it's not done? Why was it supplied to the government hospital?
Okay, so that's a fair point. But there are provisions in place for such contamination, isn't there? Pharmaceutical
Yes.
companies already have an SOP to follow. So therefore, if in this case, would it be fair to say that they did not follow the SOP?
It's obvious it has not been followed. It's not been followed. That's why. And then see, 2 days back, government gave a clearance to that. If they have given clearance, then how did the patient die?
Okay. Okay.
So-
right.
So the matter now is the government agencies, the drug controllers, and the manufacturers. They are all responsible for this.
All right. So you're saying the manufacturer, drug controller, the pharmaceutical company, they're all responsible for it. Now, I want to ask you some basic questions right now for the benefit of those who are tuning in, who are scared that should they give their children cough syrup or not. In your assessment, should
First of
children be
all-
given cough syrup?
First of all, cough syrup is not indicated in children below the age of 5 years. Right? Usually, these are common cold coughs, they resolve by themselves. So public awareness should be there that they don't require cough syrups.
So you're saying,
And most of the
Right.
cough syrup, they don't contain. And see, the glycol, if it's impurity as there by mixing glycol, the glycol is in medicated substance which has industrial use also, which is cheaper than what is being used in the pharmaceutical company. So sometimes for the cost factor, they mix this glycol because of the cost factor. Such incidents can occur.
okay. So where does the ball lie now at this point? We know that more than 13 to
It
14,
lies-
let me
it
complete, sir.
lies-
More than 13 to
Yeah.
14 students, kids have died, children have died. Where does the ball lie at this point? If you are saying for a fact that all agencies are responsible, what's the next course of action? As a doctor yourself, what would you hope the government should do, and what would you hope the parents should do right now?
My earnest appeal to the government is let a impartial and total inquiry. Let them go to the bottom of this. Who has sanctioned this? What were the drug controllers doing this? And what are the manufacturers doing on this? The government has to answer this.
Tragedy that serves also as a grim reminder, Doctor, that despite all the SOPs in place, all the FDA authorities in place, pharmaceutical companies can really get away, with such negligence to a point that kids have died and FDA inspectors are being transferred and suspended. As far as these pharma companies is concerned, what happens to their license? In your opinion, should their license be suspended? What sort of next course of action are you expecting as a
They
doctor
should
yourself?
take a very stringent actions against the manufacturers who have done it. They should cancel their licenses. A strong message should go to the pharma people that this can't be tolerated. You are playing with the lives of children. So this is not acceptable.
Okay, they're playing with the lives of children, not acceptable. Dr. Dilip Bhanushali, thank you for all those details. We are, of course, tracking that story very, very closely. It is a story that is heart-wrenching, where a cough syrup that people are expected to trust because it's advised by the doctors, it's supposed to be medically tested for all contamination, has now ended up killing as many as 16 people. Let's quickly listen to Chief Minister Mohan Yadav, Madhya Pradesh Chief Minister, who's now taken strict action against FDA officials.
आज मैं यहाँ छिंदवाड़ा परासिया बीते दिनों जो घटना हुई है, बच्चों को कफ सिरप की दवाई का वितरण में जो लापरवाही हुई या कंपनी के द्वारा बेच खराब हुई, 19 सैंपल लिए थे, जिसमें 3 सैंपल फेल हुए। एक तमिलनाडु की कंपनी का जहां अमानक प्रकार की दवाई थी, जिसके कारण से बच्चों की किडनी और लीवर उस पर असर आया और अंततः 15 से ज़्यादा बच्चों की डेथ हुई अलग अलग प्रकार के। जिस डॉक्टर के यहाँ से दवाई खरीदी गई थी, उसी के यहाँ उनको वो बच्चों के डॉक्टर भी है और कंपनी के स्टॉकिस्ट भी वही थे, मेडिकल स्टोर भी उन्हीं का नाम का, उनकी पत्नी के नाम का। इसलिए प्रशासन ने कठोर कार्रवाई की है। दुख की इस घड़ी में मैं स्वयं भी आज शोक व्यक्त करने भी आया और इससे जुड़े हुए जो पक्ष है, हमने अपनी सरकार के माध्यम से मेडिकल इंस्पेक्टर, ड्रग से जुड़े हुए ड्रग कंट्रोलर को हटाया है, डिप्टी ड्रग कंट्रोलर पे कार्रवाई करने के लिए बताया है।
You heard Madhya Pradesh Chief Minister Mohan Yadav there directing that the license of Apna Medical Store be now revoked. In fact, he's also taken administrative action against Food and Drug Controller in Madhya Pradesh, ordering the state's drug department to conduct widespread testing and prepare raids on pharmacies across multiple agencies and multiple districts in Bhopal at national level. In fact, we now know that Union Health Ministry has also taken cognizance with a high-level review meeting which was chaired by Union Health Secretary Punya Sirvastava earlier. The meeting focused on enforcing drug quality standards and promoting the rational use of cough syrup, but it's not enough. None of this is enough. Parents are grieving, asking for answers that are not forthcoming at this point. All that we know, that this cough syrup, including specifically cold riff, was contaminated, and that is the reason why many kids have died. What led to contamination? Why was a contaminated syrup allowed to be distributed across various medical retail stores? All that questions, and all those questions at this point in time need answers that parents are awaiting as we speak.
आज मैं यहाँ छिंदवाड़ा परासिया बीते दिनों जो घटना हुई है, बच्चों को कफ सिरप की दवाई का वितरण में जो लापरवाही हुई या कंपनी के द्वारा बेच खराब हुई, 19 सैंपल लिए थे, जिसमें 3 सैंपल फेल हुए। एक तमिलनाडु की कंपनी का जहां अमानक प्रकार की दवाई थी, जिसके कारण से बच्चों की किडनी और लीवर उस पर असर आया और अंततः 15 से ज़्यादा बच्चों की डेथ हुई अलग अलग प्रकार के। जिस डॉक्टर के यहाँ से दवाई खरीदी गई थी, उसी के यहाँ उनको वो बच्चों के डॉक्टर भी है और कंपनी के स्टॉकिस्ट भी वही थे, मेडिकल स्टोर भी उन्हीं का नाम का, उनकी पत्नी के नाम का। इसलिए प्रशासन ने कठोर कार्रवाई की है। दुख की इस घड़ी में मैं स्वयं भी आज शोक व्यक्त करने भी आया और इससे जुड़े हुए जो पक्ष है, हमने अपनी सरकार के माध्यम से मेडिकल इंस्पेक्टर, ड्रग से जुड़े हुए ड्रग कंट्रोलर को हटाया है, डिप्टी ड्रग कंट्रोलर पे कार्रवाई करने के लिए बताया है।